What's up, crew? Back on YouTube. We got TJ in the house. What's up, Ant, on Instagram if you want to check him out. But TJ here has been a patient for 5-6 months now, and he started off as a chiropractic patient with left shoulder pain, left leg weakness. TJ has some mild cerebral palsy, is that right?
Correct, yeah.
And that's been ongoing since you were a little guy?
I think like 2, yeah.
2 years old, got diagnosed. What's happened? How have you felt throughout your life? What have you done for it? What restrictions has it caused? What have you done to empower your body to move better?
Yeah, I've pretty much tried like everything under the sun. Very into like working out and staying active, but I think seeing Dr. Dan has kind of opened my eyes to like a different way of healing and kind of getting the body right. Definitely feel looser, definitely moving better, spine isn't as rounded. I just feel like overall stronger like in my everyday life.
Yeah, cool, man. Good points right there. A lot of what we've been working on with TJ is back chain dominance, getting him to really feel his triceps, his lats, his glutes, his hamstrings. On my Instagram, sometimes we have videos when I get to work out with TJ over in the gym. We do some one-on-one training, so he'll pop up on my stories every now and then. He's really been working on developing his back chain strength. Remember, we took those pictures and we said we want you to be like super stretched out and flexible and arched through the low back, so that ultimately we get nice and flexible and we're not here, but we're more hips back, right? And a lot of that starts with how we position our feet, which TJ's learned how to do really well over in the gym, and start to be mindful throughout the day that he's not like standing with a crooked gait or whatever, but he's always consciously standing as best as he can, balanced through the straight feet, the nice narrow columns. The columns are the legs that we talk about in the go-to coaching. And then he's been working on some pelvic rotations and some good core control, which has been awesome to see development. And TJ's been working with me now, I don't know, what, once, twice a week?
Yeah, just a couple times a week. And
usually working out like twice a week with me, and then you're going to your own gym?
Yeah, like I'll do like a normal workout like in my regular gym, and then come here for an additional workout a couple times a week.
We are going to point out in this video, actually, we're going to point out TJ's core, and we're going to show you guys where, because I got to harp on him a whole bunch here in the office to make sure that extracurricularly, outside the office, that he's doing his homework, okay? So just because you guys went through, and I went through K through 12 school and then college and whatever else, wherever you go, you learn throughout school, but hopefully your learning never stops, especially when it comes to your body, right? TJ was doing some weight training previously, right?
Yeah, weight training.
And going to the gym, and started coming in for chiropractic care here, and I'm like, dude, I need to work out with you. I need to teach you how to move the right way, which is only going to better your adjustments, right? So you cannot just be getting adjusted by your chiropractor and not putting in time to stretch, bend, and twist and move the right way, activating your back chain and developing your back chain, your posterior chain strength, okay? Look down. And TJ's got his restrictions, his spinal restrictions. Some chiropractors call them subluxations. I like the term restriction, which are generally pretty consistent throughout the body. When you grow up in your body, many of us have so many old injuries present that we've got to start to attack and stretch and move and bend and twist the right way. Look down for me. And so when I work with my chiropractic patients, we find those areas, those restriction areas, the tender areas around your skeleton, the accumulation of tightened up, inflamed, irritated tissue, which needs to be stimulated, whether through muscle work, adjustments, vibration therapy, rehabilitative exercises, body and postural positions. All of these things come together to create a healthy moving body, a body that functions well, a body that's pain-free, and a body that can move throughout life with nice fluid movement. That's what we say in go-to coaching. We want you to access your singularity, and the singularity is, which TJ's learning, the shoulder roll. Show me some shoulder.
Yeah.
down left, down right. Okay, so when we talk about the gyroscopes of the shoulder, or excuse me, the gyroscopes of the body, we have ankle gyroscopes, we have hip, we have shoulder gyroscopes, we have these ball and socket joints. A lot of our movements in the gym are centered around a figure eight pattern where we kind of flow from the left side over to the right side. The right drop in, the left release, the left drop in, the right release. And we kind of get into this nice little fluid movement, ultimately, which creates this wave-like motion up through the spine and up through the body. It helps us to reduce our joint restrictions and improve our circulation throughout the body. Look down for me. And really what I try to do with each of my patients, we try to ignite your nervous system. We try to get your brain fired up so that you can feel your body move better and better. And it's a combination, exactly what I talked about, postural awareness, your feet position throughout the day, your back chain dominance. Are you doing exercises as you sit at the computer for hours and hours and hours throughout the day that are promoting back chain dominance, or are you promoting front chain dominance, right? That bend forward versus the hips back, the shoulders forward. Look down. Look up. Look down. Look up. Look down. Nice. Back to center. Look down. And guys, what we want to feel long term, especially up in the traps, up in the neck. TJ can feel this, feel that spot right there a little bit. So many people get these big chronic neck, big chronic upper trap tension spots where the trap just gets so neurologically overactive. It squeezes up into the neck, it compresses the cervical spine vertebrae, and causes us to have headaches, neck pain, shoulder pain, irritation, inflammation down into the AC joint, the acromioclavicular joint. Sometimes we can get adhesive capsulitis or shoulder tightness, rotator cuff tears and strains, all from neurological overactivation of the upper neck muscles, the upper torso muscles. Okay, scooch forward for me. So again, as you guys have seen, my go-to for my own body, my go-to for my patient's body is having them sit, which I want you guys to practice and comment as you do this exercise at home. You take a break from your computer or you watch this video and you sit here for 10 or 20 minutes, heads up nice and high, chin tucked back nice, right there, cool. A little bit of hand pressure down. TJ right now is feeling his triceps work. If I say, TJ, squeeze this left tricep, or squeeze this right tricep, or cut left shoulder back, or gently cut right shoulder back. These are fine motor movements. And what we're working on here, as you guys can see, TJ needs some circulation down into his pinky fingers on both sides. TJ needs some muscle activation up into his mid-back, which he's working on nicely now. Cut left, cut right. And as you guys develop your thoracic rotation, your arm rotation, your back chain dominance up in the right shoulder and over in the left shoulder, you will start to feel how much more muscle power you're developing out of the tricep, the lat, and ultimately how much softer this neck gets. We're teaching the brain to overactivate or really stimulate these back chain muscles and reduce neck tension. Double shoulders open, nice. Left shoulder cuts back, right shoulder cuts back. Left shoulder cuts back. To me, this feels like your easier side. Would you say that's true?
Yeah, it's a little bit easier to rotate.
This is your little tougher side to get a little further back like that, nice, but you're finding it. Now left side. Now right side. Now double. This exercise helps us to engage and extend through the thoracic spine where so many people get that kyphosis, or that kind of like forward bend, and incredible stiffness through the mid-back tightness. So we should see some good adjustments out of TJ today. He's moving pretty well, right side back, left side back. Got that? Move the hands up to the outside of the hips. Turn the fingers in as far as you can. Cranking it up, making it a little bit different, but similar of an exercise. Propping the elbows up straight. Rolling the shoulder blades back. And just kind of sitting here as he watches TV or reads emails or takes a little quick stretch break because you've been working on the computer for too long, which you just transferred jobs, right?
Yeah. Yes.
So now you're kind of full-time computer.
Yeah.
And so now it's more important than ever that we educate and we, you know, kind of get on him a little bit to make sure that he's taking a little stretch break. Right shoulder blade back, right elbow straight. Right into there, brother. Left elbow straight, left shoulder blade back. This is your little easier side. This is your little tougher side. Maybe you can come back here and take a look. And guys, what we're looking at and what we're feeling, and maybe you can see on the camera, if we coil left, he's got nice left side rotation. And if he coils right, this is his stiffer side. He doesn't twist as well. Shoulder back now. And he also doesn't maintain this pack, so this neck gets a little tight. Left shoulder blade back. This side you can see how much he can rotate. And he maintains this like left lat activation. Now right shoulder blade back. Oh, and that's his little tougher side to kind of pull into. Now right elbow straight. And he'll feel, and now right shoulder blade back. And he'll feel this big time stretch down into the wrist, down into the arm. You feel how this side's way tougher?
Yeah.
Yeah.
Sure.
Cool. So if we want to get the thoracic spine to balance out, if we want to get the shoulders to balance out, if we want to heal neck pain, we have to develop our symmetrical bilateral, non-dominant and dominant side rotational patterns. Left side, right side, left side, right side. What this movement helps us to achieve is freer shoulder blade movement, freer thoracic spine movement, and overall a less compressed neck. Head up, chest up, shoulder, chin tuck. Nice. Shoulder blades back and down. Perfect. And right now, guys, he's just getting a nice mid-back activation. Strong through the lats, strong through the triceps. Cool. Now, some other things TJ's working on is it's common to have a looser or a weaker leg and then a compensating or a compensatory tighter leg, right? Now, TJ, when I stretch his left ankle down and out, he moves well, but his right ankle, you can see how much higher up it is, how much less internal rotation there is on the right leg versus the left leg. You see when he just lays here. So if I twist this left leg out, that's kind of easy, and this right side is his major tight side, his stiffer side. So we know that he doesn't move as well on his right side as he does on his left side. If I push this left heel down, he's got some nice mobility here. His leg bounces a little bit. Whereas if I push the right heel down, you can see how it torques and twists his entire body up here. And TJ, this is where things like balanced squats, balanced quadruped, and also that 4-point, 6-point, 8-point, and even down to the 3-point rocker are super important to help improve the flexibility of this right leg. Push into my hand and relax. Push, push, push. Relax. Push, push, push. Push harder, harder. Stop. Push. Stop. Push. Stop. Push. Stop. And push one more time. And stop. Good, back down. Now guys, as a chiropractor and somebody who's always kind of hunched over the table, bent over the table, it's so important that you guys, chiropractors, physical therapists, anybody that's watching this channel that's working on clients, you also maintain your strong stance. So you'll see me a lot of the time get into my go-to position, my split stance, drop in leg, release leg. I'm gonna work on my coil or my twist over this left leg. Push into my hand here, and stop, and push, and stop, and push, and stop, and push, and stop. Alyssa, do you want to laser Kristen's neck? Push, and stop. Push one more time, and stop. Good, back down. Okay, nice and easy, man. Deep inhale to the mid-back. Exhale down, whole way down, whole way down, whole way down. Relax those arms down. Nice. Nice. Breath in, breath out and down, whole way down, whole way down. Nice. Breath in, Exhale, whole way down, relax that knee. Nice. All right, good work, man.
That's pretty good.
One more, good. Now this way. Nice, back to here. Okay, face right side up. Notice with some of the training, the left leg getting stronger?
Oh, for sure. Like,
Yeah?
even doing the like the rotational stiff leg deadlifts. Like,
Yeah.
I used to not even be able to like get in that position. Now I can, do some weight and stuff.
Nice.
So yeah.
Breath in, exhale out, whole way out for me. Relax this upper. One more. Good. Other side for me. Straight. So the adjustments help us to loosen up quickly, right? It gets our skeleton to loosen up. It helps us access more available muscle tension. Breath in, breath out, whole way out, whole way out. Good, flying back for me. Okay? More available, not muscle tension, but muscle strength, all right? Now we talked about TJ's core, and we're gonna point out where we need him to really work at today. After we do little toe stretch. Good. Feet are getting looser too, man.
Yeah, definitely feeling it in the feet a little bit better.
Little toe here. Okay. Squeeze your toes down. Twist your knees open. Relax your glutes, relax your legs. You guys can see here, his left leg is his more affected CP leg, where he's got a little more muscle weakness. If you guys want to observe, we're just going to point out like the size of the right calf versus the size of the left calf. We're also going to point out the knee position versus this knee position. This knee is more externally rotated than this knee, okay? You can also tell how his feet are a little crooked in this position as well. So TJ, twist your left kneecap open. Left kneecap. There you go, twist it out. Hold right there.
Exactly. I don't know.
Twist left kneecap out. So a lot of what we teach guys is just trying to get him to balance out his legs with a little left kneecap open. Little left kneecap twisted open for me, dude. There you go. And you'll see as he does this how his leg and his body just starts to twitch a little bit. Nice.
Yeah.
Twist that left kneecap out. Good. Feel that left leg muscle work. Is that strenuous a little bit?
Yeah, it's not too bad. I just can't it's tough.
Can't feel it too well?
Yeah.
Twist left kneecap out. Twist left kneecap out right there. Good. Keep going. And you guys will just see how this quad kind of kicks on and off a little bit. Left kneecap out. Keep that tension down there. Keep it going, 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 keep it going. Twist it out. And relax. All right. All right, so let's talk about the core. We know TJ, who's working on his back chain. You guys can see how we've got some rib flare up here. So he's got diaphragm to work on. You guys might have seen some of the other videos where we talked about diaphragm breathing. You ready? Hold right here for me. All right. When we talk about eliminating back pain and core strength, physical therapists, chiropractors, OTs, everybody says you got to get strong. Your trainers, your coaches, you got to get a stronger core. You got to get a stronger core. One of TJ's exercises is called FOB SLR. FOB stands for flat on back, SLR straight leg raise. Hold right here for me. I'm gonna let go. TJ needs to work at home every day for 5 to 10 minutes. You guys can see as he does this how he tucked his rib cage a little better. Take a breath in through your nose for me. Hold it in, 1, 2. Exhale slowly. Full exhale, 6, 5. Keep the chest down, 3. Keep going, 2, 1. Hold it. Inhale. Hold it in. As we exhale, pull up. 6, 5, 4, 3, 2, 1. Hold it. Keep the foot relaxed. Come on, come on, come on. You got it right there. Hold right here. Exhale down. Inhale deep. Exhale down. You guys can see how the leg starts to kind of like falter and just collapse a little bit. So when we talk about developing a strong core, it's not about doing sit-ups, it's not about doing planks, although they help a little bit here and there. One of the things we need to do as people is maintain our ability to pull our leg up way high and with that knee open, foot relaxed, okay? So if we see a runner in here that has chronic shin splints, I'm gonna show you where shin splints come from. Hold right here for me. Look, watch how he pulls his toes up here. Hold right here for me. Twist your knee open for me. See how he pulls his toes up. So right now he's overactivating his toe extensors, the peroneals, the tibialis anterior, and he's yanking his toes up. So as we run, if we get overuse of these muscles on the outside of the leg, because the core muscles up here are weak, which everything's connected, we can end up with knee pain, patellar pain, shin splints, sometimes lateral ankle irritation, tendinitis, ligament pain, soreness on the outside of the ankle. Hold this leg right here, bro. You can see how much weaker on the left side than the right side he is. So he can barely get this leg up to like 35, 45 degrees. TJ has a lot of work to do at home and in our gym training, getting his core stronger to improve his low back adjustments and improve his thoracic spine adjustments. Twist that left knee open. Left knee out, like here. Okay. Keep your toes relaxed. Breathe in, breathe out. Breathe in, breathe out. TJ's gonna lay at home with the pillow behind his head. He's gonna watch TV. He's gonna do his flat on back straight leg raise for as long as he can. Take a break. Let's do the right leg up again so we can see the difference. Right leg up. Hold right here. So you guys can see right away like how he gets a little higher up on the right side. He can do more reps on this side. We're going to recommend at home that he does left side, right side, left side, right side, left side, right side, left side. So he's doing 4 sets on the left, 3 sets on the right for as many breaths as he can, whether it's 5, 10, 15, 20 breaths. Inhale deep, exhale deep. 6, 5, 4, 3, 2, 1, hold it 1, 2. A little bit less of a chest breath, a little bit more of an abdominal breath. Inhale deep, exhale deep. Less chest, more abdomen. Inhale, good. And this is gonna be something we're also gonna work on TJ with, is more diaphragm breathing, less chest breathing. Cool? All right, take a break. So we got some body reorganization to do. Let's see this hand. We got some core strength to do. We stress the elbows a little bit. And as he continues to work his back chain dominance, his palms back and down, his chest up high, his back extension. Things are going to get stronger, body's going to get looser. Relax this hand here. Okay, take a break. Sometimes these get a little painful as we stretch the body into extension. All right, nice and straight. Hands on thighs for me. Scooch right over here, just like that, go ahead. Turn right, easy here. Nice. Turn left, easy here. Nice job, buddy. Sit up tall for me. All right, guys, let's spin to the right. There we go, we got a little bit of movement up in TJ's neck, his mid-back adjusted, super nice, better than ever today actually. Scooch forward for me on the table, fingers in, palms down. We re-educate on the back chain hold position that we want to work on throughout the day. TJ's got to take a break from the computer a little bit throughout the day. He's got to pump up his back chain. He's also got to work on some coiling. And then he's got to work on a little bit of flat on back straight leg raise to get his legs able to be up to 90 degrees with a little bow set. You see I'm a little shaky here as well, but getting this leg and getting these psoas muscles, the core muscles, the obliques to be able to hold the leg up, mega important to help balance out the pelvis and reduce low back pain. Cool? All right. Nice. Real quick talk about the diaphragm. Diaphragm is a muscle in the mid-abdomen. It separates the lung cavity from the abdominal cavity, the GI tract. This muscle, when we breathe air into our nose, pumps up down here into the diaphragm. The diaphragm depresses a little bit, pushes the belly out. Getting comfortable with some abdominal breathing versus chest breathing, which you guys saw how when he was laying on his back, he's doing a little bit too much of this kind of stressed chest breathing, whereas diaphragm actually pulls up and in, causing chronic back tightness, hip tightness, tendonitis in the hips. Breathing affects everything that you do throughout your body. Being in your back chain means hips back, chest up, shoulders in front of hips a little bit. And then we want to work on this nice abdominal breath in, down into the abdomen, and exhale out. We're going to shoot some updated videos on diaphragmatic breathing. Maybe we'll use you as an example. Cool?
Yes.
All right, thanks, man. Guys, stay strong, move well, and get adjusted every now and then. We'll see you later.